Generally, you pay a monthly premium for Medicare coverage and parts of cost each time you get a covered service. There's no yearly limit on what you pay out of pocket unless you have a supplemental coverage like Medicare supplement, insurance policy, or join a Medicare Advantage plan. So what you pay for Medicare will vary based on what coverage and what services you get, and of course, what providers you visit. Original Medicare is a fee-for-service health insurance program that has two parts, Medicare Parts A and Part B. You typically pay a portion of the cost for covered services as you get them. Under Original Medicare, you don't have coverage through a Medicare Advantage plan or another type of Medicare health plan. So, our topic 1 is Medicare Part A costs. It's zero premium for those people because they or their spouse paid Medicare taxes long enough while they're working, generally at least 10 years. If you get Medicare either turn the age 65, you won't pay Part A premium. This is sometimes called premium-free Part A. And for our next topic, we have Medicare Part B costs. If you have Part B, you pay a Part B premium each month. Medicare Part B premium is $164.90 for most people. Part B helps pay for covered medical services and items when they are medically necessary. Part B also covers some preventive services like exams, lab tests, and screening shots to help prevent or find or manage medical problems. So generally, you pay a monthly premium for Medicare coverage and part of the cost each time you get a covered service. There's no limit on what you pay out of pocket unless you have, just like I mentioned, a supplemental insurance called Medigap or Medicare Advantage plan. So, I prefer to discuss the definitions of each because these are the costs involved with your health insurance or with your Medicare. You will have a better understanding of your coverage if you know the meaning of the terms. You will encounter these terms when you see a health professional or see these terms in your billing statement. So what is premium? A health insurance premium is the amount typically billed monthly that policyholders pay for health coverage. So policyholders must pay their premiums each month regardless of whether they visit a doctor or use any healthcare service. So this is a monthly obligation for you, okay? Deductible, the amount you pay for covered health services before your insurance plan starts to pay. Some plans have separate deductible for certain services, like prescription drugs. This is how it works. If your plan's deductible is $1,500, you pay 100% of the eligible healthcare expenses until the bill totals to $1,500. After that, you pay the cost with your plan by paying coinsurance. After your deductible, you usually pay only a copayment or coinsurance for overall services. Your insurance company pays the rest. Okay? So for example, coinsurance is always a percentage. So for example, they pay $100, you pay $20. That's your cost is 20%. If your cost is 20%, okay? So now, copayment, this is something that they bill upfront or they send you a bill when you see a healthcare provider. A fixed amount, for example, again, $20, you pay for a covered health service after you paid your deductible. And then the maximum amount a plan will pay for covered health care service may also be called eligible expense or negotiated rate, okay? So now let's go with coinsurance. Coinsurance, is a percentage of cost a patient pays for medical expenses such as hospital stay, office visit, medical device, or prescription drug with many health insurance plans. A patient pays 100% of the cost out of pocket until they have met their deductible. Then after meeting the deductible, a patient pays a defined percentage. Take note, percentage is the coinsurance. The coinsurance amount for additional coverage medical expenses. For example, a very common coinsurance arrangement is that the medical insurance company pays 80% of costs for a given therapy, with the patient paying 20%. Both copayment and coinsurance refer to a patient's responsibility for a portion of healthcare costs. A copayment is set. Then, what is a copayment? Copayments and coinsurance, along with deductibles, are examples of cost sharing. Take note, while premiums are paid by the consumer, they are typically not considered cost sharing. As a recap, original Medicare has two parts. Medicare Part A covers inpatient hospital stay, care in a skilled nursing facility, hospice care, and some home health care. Most people don't pay a Part A premium because they paid Medicare taxes while working. If you get premium-free Part A, you pay. If you did not, let me repeat myself. If you don't get premium-free Part A, you pay up to $506 each month. Well, if you don't buy Part A, then when you were first eligible for Medicare, usually when you turn 65, you might pay a penalty, of course, because just like I said, it's mandated. So Medicare Part B, most people pay a standard Part B monthly premium of $164.90 in 2023. Social Security will tell you the exact amount you will pay for Part B each year. Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. So now, let's go to Part A. So let's start analyzing the cost of Part A. When you get hospitalized, I suggest it would be better to ask questions so you understand why your doctor is recommending certain services, if or how much Medicare will pay for them. Okay? So now we go to premium. It is zero premium for those people who contributed 10 years or 40 quarters. If you don't qualify for premium free Part A, you might be able to buy it. You'll pay either $278 or $506 each month for Part A, depending on how long you or your spouse work and paid Medicare taxes. If you don't buy Part A when you were first eligible for Medicare, usually when you turn 65, you might pay penalty as well. So, deductible. For this year, 2023, the deductible is $1,600. There's no limit on the amount to the number of benefit, period, you have in 1 year. Okay, this means you may pay the deductible more than once a year. Okay, so inpatient hospital stay. Medicare Part A hospital stay covers inpatient hospital, of course, you're already aware about that. Care in skilled nursing facility, hospice care, and some home health care covers inpatient hospital care if you need to have both. So if you're admitted to a hospital as an inpatient after an official doctor's visit, which says you need inpatient hospital care to treat illness or injury, that covers your Part A. Well, the hospital accepts Medicare for 1 to 60 days, 1 to 60, it's zero. You don't have to pay. But if you go beyond 60th day, 61 to 90 days, you pay 400 per day copayment, okay? And that copayment, you also need the deductible to pay the deductible. And for your 91st to 150th day, so that would be a total of 5 months, you pay 800 each day while you are your 6, and then you have 60 reserve lifetime reserve days. Okay? So in original Medicare, there are additional days that Medicare will pay for when you're in the hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime, take note. Okay? For each lifetime reserve day, Medicare pays all covered costs except for daily coinsurance. After day 150, so that's about 5 months, you pay all costs, sad to say. When you're in the hospital, it is better to know that Medicare doesn't pay for private duty nursing, television in your room just in case you need the television, okay, phone in your room. So you'll also pay for a private room just in case you decide to do so, okay? Skilled nursing facility. A semi-private, skilled nursing facility is a nursing and therapy care that can only be safely and effectively performed by under supervision or professionals or either technical professionals. So this is like the rehab. It's called skilled nursing facility. Some other call it rehab. Okay, so after you get hospitalized, you have to go to rehab. Okay, it's a healthcare given then when you need skilled nursing or skilled therapy to treat, manage or observe your condition, and evaluate your care. In this type of coverage, you will be using your Medicare Part A and Part B. You will use Medicare Part A for your stay and Medicare Part B for the services you need for your confinement. Medicare covered services is skilled nursing facility includes and not limited to a semi-private room, a room you should share with another patient. Medicare members is entitled to a room with a roommate. Take note because you might want to be private. Just like I said, you have to pay. Meals is included. Skilled nursing care is included. Physical therapy, so I just have to define this. Physical therapy, also known as physiotherapy, may include certain exercises, massages, treatments based on physical stimuli like applying heat, cold electrical currents, or ultrasound. The aim of this physical therapy is to relieve pain, help you move better, or strengthen weakened muscles. So let's go to occupational therapy. So what is occupational therapy? It helps people to have as much independent and quality of life as possible. So occupational therapist works with people in the community to overcome limitation caused by injury, illness, disability, or the effects of aging. Okay, so what is the difference between OT and PT? The most basic difference between the physical therapy and occupational therapy is that PT focuses on improving the patient's ability to move their body, whereas the OT focuses on improving the patient's ability to perform activities of daily living. Okay? So now let's go to speech language pathology services. Speech language pathologists work to prevent or access and diagnose and treat speech language, social communication, cognitive communication, and swallowing disorder in children and adults. An example here is if you had a stroke and you need to be able to communicate again, so you need a speech therapies. So medical supplies and equipments in the facility, so or medical, Medical social services recovery addressing social and emotional concerns related to the patient's illness and care. Well, helping the patient access community resources to ability in The ability to recover and counseling for the patient and the family, of course, is very important. Medications, it depends on what medication, but it's covered. And don't forget, you have to have Part D. So medical supplies and equipment. And of course, ambulance. Ambulance is, you already know that, but when other transportation endangers your health, well, to the nearest supplier or need supplies that aren't available to the skilled nursing facility. That's medical supplies and equipment, of course. So dietary counseling. This covers medical nutrition therapy services if you have diabetes, especially, or kidney disease, or you've had a kidney transplant in the last 36 months and your doctor refers to these services, so you have to have dietary counseling. So home health is also covered, and at its basic level, home health care means exactly what it sounds like. Medical care provided in the patient's home, and it's covered by Medicare Part B. Okay, hospice care. So home health care can, well, of course, I forgot, the home health care can include broad care given in skilled given by skilled medical professional, including skilled nursing care, physical therapy, occupational therapy, and speech therapy. The amount original Medicare will pay for a service or an item, Medicare pays its share, and you pay for the share of the part of the cost. Okay, now let's go to hospice care. Hospice care focuses on the care, comfort, and quality of life of the person with a serious illness who is approaching the end of life. At some point, it may not be possible to cure a serious illness, or a patient may choose not to undergo certain treatments. Hospice is designed for this situation. If you decided to enroll in a Medicare Advantage plan, you will go back to original Medicare when you become a hospice patient. Let's go to Part B. Now we will focus on the Part B cost. The premium is $164.90 to most Medicare members. The amount can change each year. You'll pay the premium each month even if you don't get Part B coverage services. It's your choice, of course. You might pay monthly penalty if you don't sign up for Part B when you were first eligible for Medicare, usually when you turn 65. When you pay penalty for as long as you pay the penalty, like it's a lifetime thing, I would say. The penalty goes up the longer you wait to sign up, okay? So the deductible this year for 2023 is $226 before original Medicare starts to pay. You pay this deductible once each year. Let's go to outpatient mental health. Outpatient treatment lets mental health patients get care without having to stay overnight in a hospital. It includes services like counseling, group therapy, medical consultations, or psychiatry during regularly scheduled sessions. Well, you pay $0 for your yearly depression screening and a certain percentage Medicare approved amount for visits to your doctor or other healthcare provider to diagnose or treat your condition. If you get your services in hospital outpatient clinic or hospital outpatient department, you may have to pay an additional amount to the hospital. So, partial hospitalization mental health. Partial hospitalization mental health provides a structured program of outpatient psychiatric services as an alternative to inpatient psychiatric care. It's most intense than care you get in a doctor's or therapist's office. You get this treatment during the day, and you have to stay overnight, okay? So outpatient hospital care. you're you're an outpatient if you are getting emergency department service or observation services, outpatient surgery, lab tests, or x-rays, or any other hospital services, and the doctor hasn't written an order to admit you to the hospital as inpatient. So you're just going to the hospital and coming back home. That means you're not staying there overnight. Therefore, you are not an inpatient care. Okay, so usually there's certain 20% of the cost for each Medicare approved amount for the doctor and other healthcare provider services if you're not in hospital. Okay, you'll also pay a copayment to the hospital for each service you get in a hospital outpatient setting, except for preventive services. In most cases, your copayment won't be more than the Part A hospital stay deductible amount. So let's go to clinical lab. Clinical laboratories are healthcare facilities providing a wide range of laboratory procedure which aids the physician in carrying out the diagnosis, treatment, or management of patients. It's $0 for covered clinical laboratory services. So let's go to inpatient hospital care. Inpatient care is care provided in a hospital or other type of inpatient facility where you are admitted and spent at least one night, sometimes more, depending on your condition. As an inpatient, you are under the care of doctors, nurses, and other types of healthcare professionals within the hospital. So now let's go to home health care. The most common from home health care in some type of nursing care, depending on the person's needs actually. In consultation with the doctor, a registered nurse will set up a plan of care for you. Okay, it is $0 for covered home health care services. Okay, and then 20% Medicare approved amount for doable medical equipment like wheelchair, walkers, hospital beds, and other equipments. So now let's go to general cost for services. Service costing is the process of identifying all costs associated with building, supporting, and delivering your service. Examples of service cost components includes equipment, staff, labor, professional service, software, license fees, and data center charges, to name just a few actually. So usually it's 20% of the cost, okay, of each Medicare covered service of the item, and gets paid. You have to pay your deductible. So get help, no worries. If you have limited income, you and your spouse can be able to apply for some resources. You may be able to get help from your state to pay for your premiums and other costs. Now let's go to some Medicare questions. I'm sure you're anxious to know the answers to these questions. Say, the first question is, my spouse didn't work. Is she entitled to get Medicare? Health insurance is extended to your family when you are like when you're in a health insurance, while Medicare is extended to your spouse. With health insurance, you will have one policy for the whole family. With Medicare, although it's extended to your spouse, you have to pay separate Medicare Part B premium. So because in health insurance, you pay for a group, your family. But with Medicare, it's just your spouse, but you have to pay separate Part B premium. Okay? The next question is, my spouse worked and contributed to Medicare. I turned 65 before my spouse did. So, but I didn't contribute to Medicare. Will I get Medicare coverage? Medicare contribution, just like the first question, is extended to your spouse. If you turn 65 before he or she does, you can get your Medicare coverage. provided he or she has enough contribution to Medicare. This means 10 years or 40 quarters of contribution. You can get your Part A by paying the remaining years. He or she must pay for the remaining years or wait until he or she is eligible for the Part A until you can get it. However, as a legal resident for 5 years, you can get your Medicare Part B coverage. Okay, so Part A, if his contribution or her contribution is not enough, it's either you pay or you have to wait. But if you're a legal resident, you can get your legal resident for 5 years, you can get your Part B coverage. Okay, so I just have to reiterate myself on that. The third question is, my wife is taking an expensive drug, and we cannot afford to pay Medicare premium and the expensive meds she's taking. What are we going to do? Well, don't lose hope. There is a lot of help available for you and your wife or your spouse. You can apply for Medicaid in the state you live in. They have a program called LIS where you can get help paying for expensive drugs. Likewise, ASP Cares was just here, and they also have an available help for people who are underinsured and needs help.
Pure Medical Equipment provides top-notch quality medical supply equipment. Whether to rent or buy, Pure Medical Equipment and Supplies has it all.
Pure Medical Equipment is committed to serve and give back to Southern Nevada.
We deliver medical supplies and rentals to your door.
We use headphones as a part of our everyday lives. Whether we're at work, getting exercise, meditating, in transit, studying, practicing, or relaxing.
Hi, I'm Ryan Sway, the founder of Aircom. I would like to introduce the world's first wireless airflow audio earbuds. As a festival and a concert junkie, I really enjoy the live experience of being there and feeling the music. When we started developing Airflow, our goal was to reproduce that live experience using earbuds.
The problem with traditional headphones is that the speakers are located inside of the earpiece, literally giving you centimeters before the audio hits your eardrum.
What Aircom is doing, they're the first company to actually address the fact that there needs to be a space involved associated with having the sound waves expand fully.
The difference between traditional headphones and Aircom audio is that the air tube gives you 8 times more space, allowing the sound waves to fully develop before they actually hit your eardrums. And this gives it a much more live, natural sound, just like in a recording studio.
It's real nice that someone actually addressed the physics associated with how sound comes out.
The challenge we had was to create an earbud with enough airspace for the sound to fully develop and breathe. Unfortunately, traditional earbuds are about the size of a jelly bean, and there's just not enough airspace. However, that changed when we developed Airflow Audio. Airflow uses an air tube to deliver 6 to 8 times more airspace than traditional earbuds. The end result is a true live listening experience, just like you're at a festival or a concert. We also added magnets to the back of the earpieces so you can wear it around your neck when you're not using it.
Being that the drivers are 8 inches from the earpiece, the magnets do not affect the integrity of the sound at all.
The orange line represents the frequency transmitting through the wire to the speaker, which then converts to the blue sound wave that develops more as it travels up the air tube, producing a balanced, full body and live listening experience.
Another really cool feature is that these earbuds are sweat-proof and water-resistant because they're coated with a super hydrophobic nanotechnology. So now you can be on a skateboard or riding a motorcycle and listen to music as if you were watching a live show or actually in a recording studio.
We're coming to you for help in bringing these unparalleled earbuds to market.
It's time to say goodbye for now. I would like to thank you. It was a pleasure to spend an hour with you. I would like to thank Sabrina Hernandez of ASP Cares Pharmacy for coming to discuss how they help people save money on their prescriptions. Rest assured, I'm here to continue to enrich your Medicare knowledge. I would like to send my love, hugs, and kisses to my clients. And for those who need a reliable agent, I'm looking forward to be a part of your Medicare journey. I'll see you for another episode of Medicare Senior Info Guide. Take care of your health. That's the only one you've got. Let's join hands to a better health.